Ciao mondo, hello world, hola mundo, hello mon. We're here today in Vicenza, the International Vicenza course on hemo and peritoneal dialysis with Professor Peter Blake, taking a cappuccino and speaking about the possibility to use a low glucose concentration strategy in peritoneal dialysis. Peter, can you comment on this?
Well, first, Claudio, it's wonderful to be here in Vicenza. There is a lot of interest recently in reducing the amount of glucose that we expose our peritoneal dialysis patients to. Glucose has been a wonderful osmotic agent for 50 years in PD, but there are problems. We have known for some time that it damages the peritoneal membrane, and we also suspect that it is having adverse effects on the cardiac risk profile of our patients. So there are some approaches now that we're using to decrease the glucose load.
What are these approaches? You comment?
Well, first there are some simple general strategies. Restrict salt and water if the patient is having problems with volume. Avoid using the very hypertonic bags except in emergencies. Preserve the residual renal function as long as you can. All of these reduce the need for extra glucose. However, there are other approaches that involve substituting other solutions for the glucose. For example, icodextrin has become very popular, and one of its advantages is that it reduces the glucose load. And Claudio, you will be aware that 2 recent randomized control trials suggest that substituting glucose with icodextrin reduces the glycated hemoglobin levels, reduces the serum lipid levels, and we think this is good for our patient's cardiac risk profile.
So thank you very much. We therefore really stimulate you to go and visit these recent trials on the use of low glucose concentration strategies and icodextrin application. And with this, I thank you for joining today the cappuccino with us. Excellent.
Wonderful.